I'm Dr. Mitch Israel with Reach Rehab and Chiropractic.
And I'm Dr. Nicole Lorenz of Refined Physical Therapy and Wellness.
Now, Nicole, I have you here as an important PSA, well, for both of our patients, or really the whole Plymouth area, because you specialize in pelvic floor physical therapy specifically. That was a mouthful. So I wanted to get you on here to really go over, what are some common things you see with pelvic floor dysfunction, just so someone that might be dealing with these things in their everyday life, they know there's an end to what they're going through.
Yeah. Typically we see people experiencing a lot of pelvic floor dysfunction in that postpartum time frame, sometimes even in the prenatal time frame, as women hit that pre and postmenopausal time frame, and then sometimes people don't always realize that they're dealing with pelvic floor issues because they're having bowel or bladder dysfunction.
Ooh, okay. Not just too much beans, right? No, I'm just kidding. I'll cut that part out. Now, this is not my specialty. As an outsider looking in, I have heard of you can have some bladder issues. I've definitely heard of the terms like leakage. What would be like a good example of something you would see where someone's just not using the pelvic floor the way they should?
Well, it depends on a lot of different factors, but...
Are you saying it's gray? It's not always black and white?
I say it depends.
Yes. Our patients are used to hearing that terminology. I wish it was black and white. It'd make our lives a lot easier, wouldn't it?
Yeah, but leakage with activity, pelvic pain or perineal pain with activity, sometimes even pain into the low back or hips.
We've co-managed a lot of patients in the past. Obviously, as chiropractors, we see a lot of back pain, but especially a lot of pregnancy or postpartum back pain, where as chiropractors, especially more of a sports rehab chiropractor, we can get their back moving better, but from your experience, does that person that starts to feel better after, say, their pain goes away, is pelvic floor PT still for them?
Yeah, definitely. Just because your back pain isn't there anymore doesn't necessarily mean that you've gotten the complete aspect of care of full pelvic floor function, being able to activate the pelvic floor, relax the pelvic floor, or even kind of elongate or eccentrically lengthen your pelvic floor.
It's weird. I haven't heard you say Kegels yet.
No, you won't hear me say Kegels very often in my practice.
There's more than just YouTube pelvic floor physical therapy.
I think so.
Yeah, you can find a lot of good things online, but It's really what individually is best for the person.
Yeah, pelvic floor physical therapy definitely needs to be tailored specifically to the patient and what they're dealing with.
We've talked about how if we ran the healthcare system, it would be standardized for every, especially postpartum,
Yeah. Everybody postpartum should be coming in about that 6 weeks postpartum time frame, even if it's just to get an evaluation on movement and mechanics, and then kind of give some additional support from there. But it should be everybody at 6 weeks.
6 weeks?
Yeah,
and then...
or before, or even in that prenatal time frame. Sometimes things like pelvic pain, low back pain, bowel and bladder dysfunction can be occurring prenatally, and it gets written off.
So Nicole, I like that you mentioned the 6 weeks as a general kind of rule of thumb, so to say.
Yeah.
Now, everybody's different. I know we know that from our respective professions. Is everybody going to get the same exact exercises if they come to you at that 6 week postpartum?
No, very rarely it's anything perfunctory or systematized. It's based on what I'm seeing in front of me with the individual client and what they're dealing with, what their birth experience was, and where they're at on that day.
Yeah, because and we see it with rehab, like say just low back rehab. There's a lot of common exercises, but it really depends on what the person needs at that certain moment in time. Yeah. I would be shocked if it wasn't the same for what you do. Do you recommend the 6 weeks even if someone's not feeling any, pain, discomfort, or tension? Is it good to just get a general, hey, how is everything functioning, to kind of get ahead of a problem before it becomes a problem?
Absolutely. 6 weeks or before is a good time frame to get somebody in postpartum even if there's not really dysfunction occurring, we can give a lot of support to early exercise and movement techniques to get back to, as well as give some advice or support on how to get back into higher level activities for women who want to get back to running and CrossFit and, you know, fitness activities.
Yeah, awesome. You touched on, you know, demographic. I love the 6 week. That's the first time I heard that.
That 6 week time frame kind of gives people time to have spontaneous healing that's going to occur after birth anyways. You know, we heal in response to birth. It's a natural process. So.
Yep. And then we know from our experience with, well, you have a traditional PT background too. Usual healing, textbook healing responses, that 4 to 6 weeks, obviously that's always, it depends, right?
Yes.
But that gives you enough time to naturally heal. And actually that's a good time probably to see you because you can clean up whatever isn't back to normal, right?
And postpartum isn't just a short-term time frame. I've seen women postpartum 15 years after they've had their kids because they still can't jump on a trampoline without leaking.
Ah, okay.
And there's still room for improvement. There's still room to clean those symptoms up and get you back to whatever activities you want to be doing.
So you're saying having these symptoms, it's optional, right? Because there is there is a way, especially if you haven't gotten it checked out before in the past.
Yeah, it doesn't have to be something that you have to live with or manage. You can get, you know, treatment for that and resolve those issues.
So this was our first ever PSA, especially when it comes to pelvic floor knowledge, getting to know with pelvic floor dysfunction. I'm Dr. Israel with Reach Rehab and Chiropractic, and one last time,
I'm Dr. Nicole Lorenz with Refined Physical Therapy and Wellness.
And if you like this kind of content where we go back and forth, maybe even next time show, you know, an exercise here or there to get a glimpse of, you know, what you do, let's see what the people decide. So give us a like, comment. But that's it for us. Definitely leave any comments below if you have further questions. Well, we DM quite a bit, so I know she's active in the DMs. I don't know if that's still a slang term kids use these days. Other than that,
Thanks for having me.
yes, it was nice to have you.